Hi, everybody. Welcome to the USC Institute on Inequalities and Global Health virtual lecture series. My name is Sophia Greskin, and it's my great pleasure to welcome you to this incredibly exciting event, addressing the long-term social and economic impacts of Dobbs, a view from inside USC. And I have to say the event is done in partnership with the USC Law and Global Health Collaboration and our wonderful steering committee of folks from across the university who've been concerned with the impacts of the Dobbs decision, some of whom are represented on this panel, but all of whom have helped to shape the issues that we're going to be addressing today. So on our collective behalf, welcome. I was just saying we planned this event for after the midterms. And I guess, we all know it could have been a lot worse. So this has had important impacts for what shape the panel is taking, let alone the impact I have to say on all of our lives. But as we all know, I think constitutional rights relating to abortion were heavily supported in this latest round of midterms here in California, but also in Michigan and in Vermont, and even Kentucky, which largely already bans abortion, but voters nonetheless rejected the change that would have resulted in an outright constitutional ban. So there's a slightly more hopeful tenor to the conversation today than there might have been otherwise. And clearly the right to access safe abortion services is something that matters to folks in this country. But I think we all know that the varied impacts of the Dobbs decision go far beyond simply whether abortion is legally available to all who need it. It's a step, but it's about the longer term social and economic options and impacts of the decision, particularly for poor and marginalized communities. And I think that's something that's been weighing heavily on all of our minds, and it's very much, I think, going to be the focus of our conversation today. One tiny piece of housekeeping before we start, which is that today's dialogue is part of a series of events that we at IIGH have been hosting in the wake of the Dobbs decision, and all are available on our YouTube channel. But it's been pretty amazing in terms of what we've learned in terms of everything from service provision to advocacy to addressing the legal landscape. But this is our first event explicitly bringing together, if I can say, leading lights from within USC. And my personal hope is really through this that we can open a broader space within the university to deal with the longer term impacts of Dobbs. And I think when I mean that in terms of our research, our teaching, and our activism within USC, and beyond. And I said this is an amazing session. I said I couldn't ask for a better panel of leaders to be in dialogue with one another. But let me say, everybody here is an expert from within very different USC schools in the fields of law, of medicine, of social work, of sociology. Everybody engages in working with vulnerable and marginalized communities. And I think everybody has, I think, a very different kind of take on the range of issues that Dobbs raises. So in terms of y'all on my panel, I'd like to introduce you all at once, and then I'm going to set this up to ask questions to the entire panel. And I want to say to the audience, I'm going to introduce folks very, very briefly for the sake of time, and I'm not going to do anyone justice. So please look them up. The full bios are on the website. All right. So I will start by saying Manuel Pastor is a distinguished professor of sociology and American studies and ethnicity, and he's director of the Equity Research Institute at Dornsife. His research generally focuses on issues relating to the economic, environmental, and social conditions facing low-income urban communities and the social movements that seek to change those realities. So there's a lot to say here, I'm sure. Parveen Parmar is the director of Global Emergency Medicine and director of the Center for Gender Equity in Medicine and Science at the Keck School of Medicine, where she's also an associate professor of clinical emergency medicine. And so, as well as being an emergency room physician, much of her work has focused on supporting healthcare for refugees and other vulnerable people globally in multiple settings, including within the city of Los Angeles. Daria Rothmeyer is the Richard and Antoinette Kirtland Professor of Law at the Gould School of Law, where she teaches and writes about persistent structural racism in labor, housing, political participation, wealth, and education. Her book, Reproducing Racism: How Everyday Choices Lock in White Advantage, explores the self-reinforcing dynamics of persistent racial inequality. And I think super relevant to our conversation today, her work is heavily interdisciplinary, where she draws on economics, on sociology, on political theory, history, law, and complex systems theory. And John Blosnich is an assistant professor and director of the Center for LGBTQ+ Health Equity at the Dwork Peck School of Social Work. And and John's primary area of expertise is disparities in suicide risk and prevention amongst LGBT individuals. He's done really foundational research on transgender veterans, health and healthcare utilization, and all with a special emphasis on the social determinants of health. So again, quite key to our conversation today. So y'all, you can see what a panel. And so please, as an audience, if you can drop any questions you might have in the chat, we'll come to your questions at the end. And like I said, I'm going to run this as a series of questions. And I thought maybe if I could start, if I could ask each of you to orient us to the kind of work you do, and kind of as relevant to how we're thinking in the current moment, the ways in which each of you engage with solidarity and justice issues in your work broadly, just so folks can get a sense of who you are and the framing that you bring to this conversation. And if I may, Manuel, may I start with you?
Thanks, glad to be part of the conversation today. Manuel Pastor, and I'm director of the Equity Research Institute, as Sophia mentioned. And our slogan is data and analysis to power social change. And in a word that really describes what we do, we provide data to movement organizations, community-based organizations seeking to affect change in the world. We recognize that data and analysis do not actually change the world. One of the things I try to insist with my research staff is we don't change the world. We work with people who change the world so that we understand that the real power to change the world comes from organizing, comes from people power, comes from our ability as researchers to stand in solidarity with those who are on the front lines of this struggle. I guess one thing I would just mention that I think drives some of our interest, my interest in this. I was just giving a talk at the San Francisco Federal Reserve. This was probably an inappropriate thing to say at the Federal Reserve, but we were talking about climate change and about people who deny climate change. And I was saying, well, let's be real, at least in the United States, the people who deny climate change are also denying a woman's right to bodily autonomy, are asking us to forget the racist history of the United States, are seeking to deny the power of elections and what elections tell us. And I think what we need to realize is that the movement to strip women of their reproductive rights is not simply a struggle that's in that sphere alone, isolated from the broader set of politics that are around it, which are about domination of the planet, domination of certain communities, particularly communities of color, domination over a political system so that elections with this changing demography won't count, and certainly domination over women, over LGBTQ communities, et cetera. So, those of you who do data know about factor loading, which is how it is that things that are similar sort of all load up in one area. You can say, geez, that's can be represented by just one variable. We've got a kind of fascist factor load that's really getting stronger and stronger in the United States. And so I'm really glad we're here talking about Dobbs. And I just hope that we keep thinking about how this is part of a much broader crisis of American democracy and human rights.
100%. And it's very appropriate to speak about at the Federal Reserve, I have to say. Daria, can I go to you next, please?
Yes. So I am a critical race theorist, and thanks to the right, most people know what that is now. I teach constitutional law, so I'm going to have to teach the Dobbs decision next semester, which I'm dreading and thinking a lot about how I'm going to do. But in addition, I'm teaching critical race theory. I write about structural inequality and about racial capitalism. These days, I'm focusing on two areas of research, both of which will be impacted by Dobbs. In one project on racial capitalism, I'm exploring the way in which some of our most high-profile innovations in the digital economy space rely on racially exploiting workers of color. and women of color in particular, like the immigrant women who soldered the circuit boards that launched the Mac for Steve Jobs. Of course, Jobs and Apple profiting immensely. And these women exposed to toxic chemicals and suffering reproductive injury, earning frequently much less than minimum wage. And then in the other project that I've just started, I'm working to map the impact of events like COVID, police violence, incarceration, like Dobbs, along the grooves of disadvantage that are cut into our social landscape by vectors of vulnerability like race and class. So if we were to take Dobbs, for example, to map the impact of Dobbs in the long term, not just in terms of women who can't get abortions, or even the impact on them with regard to poverty and health and relationships, but the broader impact in terms of food security for their families and their communities, and bankruptcies, child truancy, all sorts of outcomes that we're going to be looking at, to look at not just the immediate effects, but the ripple effects. And I'm actually looking forward to talking to you about that project, Sophia, because I think there would be much for us to discuss.
100%, 100%. John, can I turn to you?
Sure. Hey, everybody. So I've studied LGBT health disparities for probably 15 years or so. I found my way. My background is in public health. I'm in the school of social work. I'm not a social worker. But I, found my way to research because of my bent for advocacy. So I sort of became a scientist with an axe to grind in terms of, the disparities and inequities that faced LGBT communities, and sort of the really effective ways that people are relegated to second-class citizenry by even having a conversation about whether they should have something or not. Should LGBT people be able to marry? Just the mere posing of that question and the discussion of it already relegates somebody to a lesser than status. So that, for the longest time has not just that issue, but just, as an emblem of why I sort of pursued public health and research and finding my way into how data can help us, cast sunlight on a lot of this, not just for advocacy, but also so we can remember. Because the more I've been in this, the more I've realized that we tend to forget a lot of things, and it's only I think getting worse because we just have an inundation of information all the time. So some of it's for advocacy, some of it's for posterity, some of it's for me just being able to feel like I can, do something, And so I've focused mainly in suicide research. And, the way that I sort of conceptualize that is thinking about the social production of morbidity and mortality. Also sort of thinking about equity in data, and how even though suicide risk disparities, disproportionately affect LGBT populations, we have no mortality information on that group. So again, the power of data to help us understand, how folks are represented and the full cost to what sort of erasure means to our efforts to pursue equity. So yeah.
Totally. It seems like data is going to be a recurring theme through what we're all looking at. Totally. Pardon me, please.
Yeah, absolutely. So I am an emergency physician. I have a background in public health. I conduct research primarily looking at sort of identifying best practices for programs, health programming for refugees, so populations affected by conflict and crisis in a variety of settings. I do some work both abroad and so outside of the US and also inside the United States. Inside the United States, I do work with immigrants in detention centers primarily. So we did some analyses of deaths between 2011 and 2018, looking at various factors associated with deaths there. I do, and then, also looking at, I've worked with sort of individuals that have been subjected to force feeding and other things. And it's interesting, I think about I think a little bit about the relationship between the force feeding issue and health and detention and abortion in the Dobbs decision. You know, I heard a wonderful quote over the weekend at a conference that, and I'm sure it's one a lot of people know, which is, if you mix science and politics, you get politics, right? And that just that just resonates with so much that we're involved in. And I think that the Dobbs decision is just yet another example of that. So my day job is I'm an emergency physician. So I see patients at LAC, USC. And I've worked at a few places around the country. And I think, so one of the things we're kind of reflecting on as a medical community, and there's a lot of us kind of doing it, is exactly how is this decision going to affect the delivery of care? Because people think this is just about, you know, eliminating abortions. And by the way, abortion care is a core part of standard medical care. It has been standard medical care for many, many years, 50 years plus. The mortality rate from these procedures is extremely low. So this is something that is safe, accepted care. And now we've had a legislative impact on our standard of care. And I think, again, there's overlap with things like healthcare and detention settings. And when we're, doing things like force feeding with people that don't have the ability to, that are specifically saying, I do not want this done to my body. And then we're doing it to their body because it's being legislated or it's a judge is saying to do it. So yeah, I could take that in so many different directions, but I'm sure we're going to get there with our discussion. So I'll stop there.
Okay, no, thank you. I super appreciate that. I was thinking, I wanted to ask you all just really quickly, this is a quick kind of go round, which is, did you really think Roe was going to be overturned? Right. I mean, none of you have this necessarily as an explicit area of your work. But, when you heard the news, did you imagine, and whether it's you heard the news at the leak or you heard the news, like when it actually happened, like take it as you like, but just, did you imagine that the decision was going to be relevant to your current work? How's that turning out? Just really quickly, just before we kind of plunge into some more substantive questions. John, can I start with you just really quickly?
Sure. I can't say that I was maybe surprised, but that could just be, hindsight. I feel like it's been a long political, a long game, a long strategy that the conservatives have been driving. And that it culminated in this. But I immediately sort of went to other decisions after that. And that, the nation sort of turned to, Obergefell, marriage, equality, so that's sort of how it,
100%. Got you. Daria, may I ask you quickly?
Yes. So I actually attended the oral argument in Casey versus Planned Parenthood. I knew then in 2009, when Obama failed to prioritize passing the Reproductive Justice Act, even though he had campaigned on it, I knew that this was a long game. And so I was not surprised at all.
Yeah. Okay. All right. I guess that's where we're all going. Manuel, can I go to you?
Well, I mean, after Trump being elected president of the United States, very little is surprising. And it's also just super clear that this was part of a long-term agenda. I mean, what part of Kavanaugh did you think was not lying to you? What part of Gorsuch did you think was not telling you really the truth? So the duplicitousness of placing people on the Supreme Court who said that they would respect precedent, but were receiving support from the right because of their willingness to overturn precedent. This seemed to me to be something that's been cooked for a long time. And I think Daria can talk a little bit more about this, but I think there's a set of other decisions that may come down around affirmative action, around a number of things that are going to overturn things that we thought were a firm part of the US legal system. And I think that the level of disrespect for the court that was shown by these Supreme Court justices in overturning precedent is going to be matched by a level of disrespect on the part of the public for the court. I don't know whether that's going to translate into expanding the size of the court, but the idea that the court has legitimacy higher than our typical political actors, I think that's really under siege right now.
Yeah, 100%. Yeah, Parveen. Yeah, I'm with you.
I was surprised, but I think that might be because in retrospect, I think I was in denial. It was too
Fair.
too shocking to consider. I thought this was just more of a political ploy to gather votes rather than a real thing people were going to do.
And
Parveen needs my therapist to prepare for bad news.
Yeah.
exactly. Hey, all right. So let me take us back specifically then, in terms of the impacts of the Dobbs decision and really kind of what brought us here. And I think we all know, everybody knows that decision isn't going to impact all people in the U.S. equally. I mean, it's particularly true for the many poor women, many who are Black, many who are Latinx, who were already living previously without real access to abortion services. And I think one of the things that a lot of my work focuses on is that even when there's good law, there's often a gap between what's written on paper and what happens in reality, right? And so that kind of issue is there. And that's absolutely a reality pretty much in all parts of the world. And I guess, Parveen, can I start with you since I ended with you? So given your work as an emergency room doc and the fact that you work here in LA, but you work in other parts of the world, what are the most kind of immediate and longer term impacts of the decision for the communities that you work with that you've been thinking about?
Yeah. It's as you said, when you pass a law like this, there are so many unintended and sort of not clearly predicted consequences of it just from a medical standpoint. So, we've now injected something into, from the legal sphere into the medical sphere. Very smart people on the legal side do not understand the medical sphere, just as very smart people on the medical side do not understand the legal sphere. So lots of unintended consequences. For example, probably people have been reading the news about miscarriage care, right? There was a story that just hit NPR yesterday. I don't know if people have read it. If you haven't, look it up. It's about a woman who was, I think, in DC or another state where she did have good access to abortion care. She had a desired pregnancy, went to Ohio for a family event, and essentially ended up bleeding heavily with what she knew was a pregnancy that wasn't going to make it. So she was sort of having a miscarriage. There's, when you're detect a miscarriage early in early pregnancy, a lot of times we'll do what's called expectant management, to kind of have the woman avoid a procedure rather than going straight to a D&C or to medication management. And she was bleeding in Ohio for 7 hours or 9 hours. And, her blood levels dropped and she nearly passed out. And all of this because the physicians in the Ohio emergency department were afraid to do what was medically necessary because it involves potential jail time and fines, and that's one example. This is literally happening all over the country where there are laws against abortion. The same with medication. So this, you think about mifepristone and misoprostol are medications that we prescribe for a variety of conditions. Now, women who either need it to manage, a missed abortion where they're trying to sort of, deal with a pregnancy that unfortunately, may have been desired but didn't make it, they can't get access to those medications and they're sort of questioned and, treated disrespectfully by pharmacists who are also just terrified. So there's a lot of issues from that perspective. Then, of course, women that have, fetal demise and fetal demise or, condition where the fetus is just not going to make it, being forced to carry pregnancies, much longer than they should have to because people, there's a law that says that they can't get standard of care. Not to mention, and then there's this issue of this, state by state, and the way in which this varies, right? So people are being counseled, if you need this service now, go to another state. But in some states, they're afraid to even be able to have that conversation with their patients because they could be sent to jail for that. I think there was a law, I believe in Tennessee now, that says that if physicians, give standard of care delivery that meets standard of care or even meets the law that it's, performing a sort of medical abortion or surgical abortion for, one of the exceptions under the law, that they could still be prosecuted. They just have to defend themselves in court. So now you're putting physicians in the very difficult position of having to defend standard of care, which of course everybody's just going to, no doctor wants to go to court. Like, we're just not going to give the care we're supposed to give to people. This shouldn't be a surprise to anybody. And then, it's, and I think just with the question with regards to the populations that it's going to affect, one of the saddest things, of course, people of color, of course, people that are poor, but gosh, this is really going to affect, you think about the typical sort of rural, poor, maybe even Trump voters, really those families really getting affected by this law. Those are the folks that aren't going to be able to get access to services, that were already in deserts for these kinds of services. So it's such a tragedy all around.
100%. Anybody want to add on to that in terms of the communities that you work with? John, anybody? Okay.
Well,
All right.
one thing I would add to that is to understand that people realize this, particularly the racial dimensions that Parveen was talking about. Some of the polling in the wake of Dobbs, while people might expect that Latinos who are often Catholic, sometimes evangelical Protestant, would be quite opposed to abortion rights. About 3/4 of Latinos support abortion rights. It's about 70% who say that even if their faith figure was giving advice that this was not something to do, that they feel that it's really a woman's right to choose. So one of the things I think that's crucial about this is people know what rights are being taken away from them in terms of their ability to decide basically when they want children and how it's going to fit into their whole life in terms of their income profile and income trajectory and current circumstance. So I do think that there's a lot of sort of false narratives that are put out there by conservatives about, in particular, that yes, maybe Latinos are going to be hard hit, but they certainly want this to occur. The data on the polling shows not. We Latinos are able to gleefully ignore the Catholic Church just like everyone else, even as we pray to Jesus and his glory.
Thank you for that. Sorry.
If I could just add one clarifying point, I focused on the exceptions around miscarriages and, kind of those things that don't relate to abortion. But, now we're in the position of having to teach our residents graduating from an emergency medicine program how to deal with the complications of self-induced abortion with potentially dangerous objects and agents, because women don't have the autonomy to decide, for all the reasons that Manuel mentioned. So it's a truly horrifying position for clinicians to be in.
Yeah, and worse depending on which states you're in, right? As well.
Exactly. Yeah.
So yeah.
Well, that's one of the reasons why it is affecting Black folks so much, because the southern states are where a lot of Black Americans live, and they're under the biggest restrictions in terms of abortion rights. So that geography of difference is also going to be incredibly important. And if I might add one nuance too, and then I'll be a little bit quiet. I was talking about how so many things line up: the opposition to critical race theory, the opposition to elections, etc. This is not to say that there aren't people who sincerely, deeply believe that abortion is something that shouldn't be done. And I think that belief is to be respected, but it's not to be imposed on other people.
100%. I mean, 100%. So, I want to say that each of you work at the intersection of race, of class, of urban-rural divides, of gender and sexuality, of marginalization in different ways. And Maria, if I can ask you to start us off, and I apologize for my puppy who absolutely wants everybody to pay attention to him, but in your book, Reproducing Racism, you discuss the legal and economic feedback loops that maintain white advantage in housing and education and in the job market. And I wondered if you could talk a little bit about how you think the recent decision is going to impact these dynamics.
Sure, I really welcome the question. I think I'm going to focus my answer on the intersection of race and class, although obviously the rural-urban divide has an important role to play, as well as these other intersectional factors that you mentioned. So researchers document a discontinuous threshold above which families are able to save and accumulate wealth. So if you're above this threshold, you can save and use your money to make money. But below this threshold, you're vulnerable to a death spiral. So below the threshold, people are living from paycheck to paycheck, using their money for short-term survival purposes. And these families below the threshold are vulnerable to what I think of as the death spiral, because events like a lost job or healthcare expense can send them spiraling downwards. If you're evicted, then you can't hold a job, you lose the job, which means you can't pay your bills, you go into bankruptcy, et cetera. And so those unexpected events can have a huge difference in terms of triggering this spiral downwards. And I think thinking about this dynamic of the spiral upwards and spiral downwards, it's easy to understand why carrying an unwanted pregnancy to term can make a big difference, and in particular, two ways. First, in terms of moving families below the threshold. So the additional expense can move families below the threshold, and then being the event that triggers that self-reinforcing spiral downward. There's this fantastic study. I recommend everyone take a look at it. There's a book on it called The Turnaway Study by Diane Foster. This is a longitudinal study that follows 1,000 women who wanted to obtain an abortion, and is a national sample of women who made their state pregnancy cutoff for abortion by a few days, and then those who just missed it by a few days. And they're able to match these women again. All of them wanted abortions, to compare them over 5 and 10 year periods. And their outcomes are what you would expect in terms of poverty, work, the impact on other children, which I quite find fascinating. 40% of women that they surveyed actually cited financial reasons for wanting an abortion. And for those women, especially those women who were turned away and unable to get an abortion, had a really significant negative impact with regard to their poverty. And then, of course, because class is related to race, women of color, in particular Black women, who were more likely to cite financial reasons, given wealth and income gaps that are based on race, for abortion. They were the ones to really see the difference with regard to their outcomes in terms of poverty. The regional differences that Manuel mentioned, rural areas obviously also having an impact on their outcomes. And then I think just more generally, race affects health impacts and maternal mortality. Even Serena Williams faces structural and individual discrimination with regard to maternal injury and maternal mortality in pregnancy. So of course they will suffer disproportionately the impacts from forced pregnancy, and they'll be less likely to be able to get abortion by other means, driving to other states, et cetera. So all the things that you would expect to see with regard to the impacts on people of color, but this self-reinforcing dynamic, both to be able to save, if you're forced into pregnancy, you're less likely to be able to be above that threshold and more likely to be below the threshold, maybe even spiraling downwards.
I super hear you. Anybody want to add anything to that? You kind of said it all, but so we'll take it at that. So thank you for that. I want to take us to the fact that we're at a research university, and the fact that we represent very different schools and very different kinds of disciplines, and to focus on what this can mean for how we think about research going forward. And John, so much of your work is with LGBT communities and addressing the social determinants of health. I wonder, can you start us, I guess, on this? And I will ask for us to go around for this one, and thinking about how the scientific community, how can we be employing our skills to think about evaluation, about documenting kind of the social and economic impacts of this decision?
Yeah, absolutely. So I think it's sort of thinking about this in three stages of well, what do we have? And essentially, what we have is a natural experiment, right? And everyone who, natural experiments, nobody's consented into a natural experiment. It just sort of is. But, what we really need to do is mobilize, our data infrastructure to be able to, Sophia, what you said, really document this, but also have a keen eye towards where the impacts are going to be disproportionately felt. And we know that's going to that is going to happen. Natural experiments are not unusual. There are quite a few public health examples. one example that kind of, I was thinking about today, I was just thinking about this conversation is helmet laws. In states that have taken away, had helmet laws, taken them away and then reinstated them and been able to document that when they took this away, the amount of harm that it caused the population, the increase in traumatic brain injuries, the increase in life-altering injuries, the increase in fatalities, collecting those data, and it seems, almost like it should go without saying, but I think that it kind of actually bears repeating, is if you don't count something, it doesn't count. And so we absolutely have to be able to monitor, these adverse outcomes, Parveen, to your point about individuals who are coming to emergency departments and, all of the unintended negative sequelae of this decision need to be documented, right? And so we have precedent in public health for how we can actually sort of gather that information. In the LGBT realm, it's really been looking at the associations of policies with self-reported outcomes. So a little bit more like research data than what we can, what we think about when we think about administrative data, right? So, documenting a problem, you have research data, you could recruit people to a survey. And then we have administrative data like electronic health record data, social service data. Although these data were not designed for research, they can really help researchers and help us understand where we see peaks and valleys and how that lines up with disruptions to systems like the Dobbs decision. And so that's sort of like what we need. And then, what do we do is we have to monitor the hell out of this situation. And, do we see increased volumes in social service agencies? We've got to really document the humanitarian and societal costs of this, but we've also need to document these sort of what's promised in this. And I think that's what conservatives have tried to, pave this over as, oh, well, Arkansas is one example, right? Asa Hutchinson actually said, potentially up to 3,000 new births this year in circumstances in which the mom might have otherwise considered an abortion. So obviously that calls for increased level of investment and support, right? And so he was calling for, I think, $5.5 million to extend home visitation through Medicaid. And this is in Arkansas, right? So holding legislators accountable for these promises they make, evaluating these systems that they say they're going to put in place and what effects they do or do not have, but looking at them in the context, right? So in Arkansas in March, they also approved $75 million to build 500 more beds in a prison. So holding people accountable to where their priorities seem to be, right? And then the last thing I'll say about, what do we do with all this stuff is we still need to engage communities in this. We know that the sharpest edge of this is going to cut minoritized populations, and minoritized populations are also people who have been misused and abused in research. And so moving forward with this, we've got to be able to go hand in hand into communities to make informed research, decisions, informed research, focus areas, and how those findings are discussed. And making sure that they're not being hijacked by disinformation rackets.
100%, 100%. I'm totally with you. Please.
I'll say something. I think we need to be studying elections and legislative fixes. 61% of voters say abortion should be legal. We should be studying whether voters, in particular conservative voters, but also Democrats, will hold their legislators accountable. I read a disturbing statistic that there were a significant fraction of people who thought abortion should be legal who were still voting for the GOP candidates who were pro-life. If voters aren't holding their legislators accountable, why not? Where is abortion on people's priority lists? I think the easiest fix here is a legislative fix, but that doesn't happen unless we understand why voters put abortion where they do on priority lists, and why legislators who campaign on issues don't end up doing what they promise, Democrat and Republican alike.
Yeah, I got you. I totally got you. Manuel, anything to add?
Yeah, two things. I concur with John that we're going to need to be collecting data from this god-awful natural experiment to show what harm gets done. But I also think we need to be careful about overemphasizing the role of data in political decision-making, because what about the data wasn't clear even before this? So I think we need to be, as researchers studying, Daria was talking a little bit about elections, but also about how people form their political perspectives, and why is it that such a perspective deeply rooted in domination over the planet, over people, has such appeal in this particular moment in time. I'm only moving because my lights keep going on in the background, off in the background. And then the second thing is sort of beginning to, and I know this is a topic we'll move to, think a lot about solidarity. Because I am really pleased that apparently today in the Senate, 62 senators voted to move forward a bill that's going to help to protect marriage equality to some extent.
I know that happened. Yay. Okay, sorry.
That's great. I think they got over a filibuster hurdle. But what you don't want to happen is, I mean, one of the things that went through a lot of people's minds, mine too, with the Dobbs decision was, well, what does this mean for marriage equality? And you don't want, like, oh, now we're off the hook, for us not to stand in solidarity with, if my issue is no longer the one that's going to be threatened, that I'm not sticking with this issue about reproductive rights for people who bear children. And so I think one of the things that we all really need to practice is solidarity, figuring out, solidarity is what you do when no one is looking, and solidarity is what you do when it's not happening to you. And so how do I, as a cisgendered straight male, understand that I need to stand in solidarity around queer rights, around reproductive rights, et cetera? And how do we develop the habits of solidarity, which are completely counterposed to the habits of polarization and domination, which are driving us to a really bad set of politics? So I think the Dobbs decision is about reproductive rights, but it's opening up a bigger can of worms about, and bigger set of possibilities about why we don't build ties together and how we do build ties together.
I want to come back to that in a minute, because I do want to come back to solidarity and economics. I'd like, Parveen, if you have any last comments about research before we move into that conversation.
I do. I tend to agree with Manuel. I think that, certainly documenting, well, with everybody, I think documenting the impact of this in clear ways is really important. But, ultimately, I don't think people make decisions. When you think about the way this is likely to change, people are not going to make decisions because, of well-conducted research, it really directly, I guess. I mean, they will, but it has to be communicated in very clear ways. And I think what we have to be responsible for is thinking about how, as scientists and advocates, we make this not a women's health issue, but a family issue. I mean, this is an issue that affects all Americans, regardless of your background. This is important. It's important to people, at all levels. And how can we really use our background, our backgrounds as, well, sort of for my community as physicians, I think we're used to speaking to people that don't believe in vaccination and don't believe in whatever, but how do we start to speak to a broader audience so that we can really start to help people understand why this is so critically important and build solidarity around all the issues Manuel said?
I mean, yeah, and I just want to add to that there's two things. It's about the impacts of this decision, not only within the US, but around the world, in terms of kind of what that means, in terms of what that means for what's happening now in other places. And then I think the other thing that I'm really struck with in listening to you all is also the fact that it's not one or some, it's all of this. It's the different disciplinary perspectives are exactly what we're talking about. Like, we need all of these different pieces. And that's, again, in my mind, sorry, but what's kind of the beauty of a research university is the fact that all these different pieces come together. So, okay, so I want to come back to solidarity. And and solidarity economics, Manuel, is really a term that you and your colleagues have coined, and I think many of us have kind of come to that language because it really does speak. And I just, could you talk a little bit about how you define solidarity economics based on what you said? But I'm particularly interested in thinking about now moving beyond research, which is where we just were, in terms of what this means for advocacy and what this means for how this can potentially inform or bolster reproductive justice movements.
So we have a new book on the topic.
Oh,
Thank you for mentioning that. Yeah, and beautiful cover. And there's actually a website called solidarityeconomics.org, solidarityeconomics.org. And in keeping with what Parveen mentioned around communication, you can download a copy of the book for free. And you can also download a comic book version, which can be used for popular education around this perspective. I've spoken a lot, so I'll just say two things very quickly, which I think are relevant to this conversation. In the book, we insist that we need to stop talking about the economy and start talking about our economy. When you say the economy, it sounds like a set of rules out there made by God or nature or the market, rather than a world in which we live, a world that we made. And this set of decisions around reproductive rights, this is our society, and we need to put ourselves in it. The second thing, there's a bunch of other things in the book that I would lift up, is that we insist that too often people who are progressive talk about equity as a kind of fairness or inclusion issue. And believe me, I agree that we need to value fairness and inclusion. But equity is also an economic prosperity issue. When you over-incarcerate, you're tossing away talent. When people are vulnerable because of their lack of immigration status, businesses don't get started. When you have racist educational systems that diminish the productive power of youth, your economy is weak. And when you strip away reproductive rights from women, you are wrecking the ability of people to plan their families, choose their timing, and be able to succeed economically. When you're hypocritical in the way that John talked about in terms of saying, I don't want women to have abortions, but I'm not going to provide any support to families that do have kids, you are diminishing our economic productivity. When you are homophobic or transphobic, you're kind of pushing people out of a labor market who can succeed and contribute. That's not the only reason to be involved in equity, but I feel like we who are progressive too often act like equity is going to come at the cost of something, when in fact equity, particularly around this issue of reproductive rights, is going to be so beneficial to the ability of our economy to succeed and for families to be able to thrive.
Gotcha. Absolutely. Beautifully said. Gotcha. So responses to that, to both to what Manuel said, but also basically in terms of just thinking about the concept of solidarity and how this can bolster kind of movement action kind of going forward. John.
Oh, wait, I think the Doria's hand was up.
Oh,
No, go
sorry.
ahead. No, she called on you. You're on.
Well, I agree with all that. And I think that, this issue around, how do we put data into action for people, and around issues of maybe like literacy or numeracy, but getting back to why do people ignore, right? What are the motivations for ignoring, something that, like Parveen, you said, was standard medical care up until June, right? How do people square that? I don't know how we bridge that divide from individuals who seemingly, if we can't get our footing around, how do we begin to understand that? How do people sort of vote against their best interests? I think that's something that Dre had brought up about what is driving people to vote against their best interest in some places, right? It's kind of, yeah, it's bewildering. I don't know.
Yep, I'm with you. Daria, okay.
We know why they vote against their interests. Politicians stir up fear and tell people that they need to look out for themselves instead of other people. It's a way of enacting an elitist, corporatist agenda. Abortion is a wedge issue that's important to getting the vote out. And yeah, I think the real divide is between people who think of themselves as individuals and connected to each other, and people who think of themselves as part of a planet, a country, a community where we ought to care about other people, and figuring out how to turn one into the other is one of those grand wicked problems that our provost wants us to solve.
100%, 100%. Parveen, anything to add to that?
Yeah, no, I mean, I think it's really interesting, because there are people that will come in, I mean, I think COVID and COVID vaccination just comes to mind as the other thing where I'm like, it doesn't, there's so many examples, I think, in medicine where, it doesn't matter what the facts are. There's an emotion there and trying to get past the emotion to get to logic is really challenging. And it takes a lot of patience and listening. And sometimes I tell you what, it's exhausting, for me. And I'm like, oh God, I've been through this a million times. Do I really have to go through this again? So I don't know, it's a frustrating, wicked problem, but I feel like it is, the only answer I have is, do we just keep listening? I don't know. It seems like listening, yelling, screaming, data sharing, tweeting. I don't know. I'm just a doctor. That's for the smarter people to figure out. I have no idea.
Nice try. Nice try on that one. So listen, I want to open it up so that people can put questions in the chat. So please do. This is your moment. I have one question here that I do want to come from, which basically asks, we now know that Karen Bass has won the mayoral election. And the question is, what impact do we think that this can have on public health, specifically in Los Angeles and specifically in relationship to this decision? And of course, we all are guessing in this moment, but the question is directed specifically to John and Parveen, but I think anybody can answer that question.
John, do you want to answer?
Go for it.
I don't think I have a great answer for it. I think that the problems that specifically maybe that we face in public health in LA County, if that's what this question is really getting at, our local sort of environment, are equally as complicated and complex as any other problem we might think of, even on a national scale. There's still a lot of perspectives to weigh, and how Mayor-elect Bass is going to kind of navigate all of that infrastructure. I'm not sure. I'm hopeful. I think we would all be hopeful. But I don't know how to answer that question about what impact to expect, I guess.
Or to hope for. No, fair enough. Totally fair enough. Parveen, anything to add?
Well, I would just say that I think that LA County has been really good about considering what role we might take, as a community in supporting women that come to Los Angeles for abortion care. And, I know the state's put a lot of resources into that. So, I would hope that, and I can't imagine that she won't, that Karen Bass will continue those policies, and probably grow them. So I think it's likely to be a good thing.
There you go. Daria or Manuel, anything to add? Yes, please go for it.
Yeah, I wanted to add something about the political impact, because, she is likely to not just win, but trounce Rick Caruso against $110 million of spending, and the most spending, $13 million, that's ever been done on a ground game in Los Angeles. She's on track for an 8 to 9 percentage point victory. And a lot of that has to do with her portrayal of Rick Caruso as a person who only recently came to the Democratic Party and who gave money to candidates that sought to restrict reproductive rights. And then when you think about the Kansas vote of the summer, the rejection of so many Republicans in this midterm, and then also the codification of abortion rights in several states in this cycle, I think one of the things that is the case is that the Republican Party thought that abortion politics was actually really good politics for them. And now it's snapping back in somewhat unexpected ways. So I actually think there's not much that Karen Bass is going to be able to do at a local level in terms of public health. That's a county function. The city can help a little bit, et cetera. But I just think the ability to say that this is part of a broader rejection of Republicans and former Republicans because of their support to restrict reproductive rights is going to embolden a Democratic Party that was scared to talk about these issues, and I think strike some fear in the hearts of Republican political leaders who are a little bit like the dog that finally got the car and doesn't really know what to do with it now.
I was like, I had to get the analogy in my head. I wasn't quite getting it. I got it. All right. Thank you. So, Doria, anything to add to that point?
Just that Karen campaigned on making Los Angeles a safe haven. And I think that's where she can play a role.
There is a question that's specific to you that's come into the chat, which is around the degree to which ballot initiatives are viable ways of expressing the will of the people on specific issues like this, particularly in red states. And I wondered if you had anything to respond to on that.
Yeah, I mean, I think ballot initiatives are great as an expressive tool to express the will of the people. I think primarying Republican candidates in the way that we saw happen on the other side, Trump candidates primarying more moderate incumbents. I think if we're serious, we need to put up or encourage Republican voters to put up Republican legislative candidates who will vote for the Reproductive Justice Freedom Act. The other thing to note that I think has a lot more promise than ballot initiatives is we control the Senate. Democrats control the Senate. Judges, 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 judges. That was the GOP long game. That's why the Supreme Court looks the way it does. Funding from the Koch brothers for the Federalist Society, finding super conservative judges who made their way to the Supreme Court. We need a counterpart campaign on the other side.
So with that, what I want to do is I want to give each of you a minute for any closing thoughts. This hour, I don't know about for the rest of you, but this hour for me has completely flown by. All right, so I can't even believe we're right at the end here. But I want to give each of you any kind of closing thought that you feel like you absolutely want to put out there. And please, Parveen, can I start with you?
Yeah, sure. I think that, we're just at the beginning. The stories are just starting to come out. And this is a really scary time. I mean, especially if you are one of those women or families that don't have the resources to fly to a place that is a sanctuary, and you don't, or even if, there's been misinformation among our population in LA about the legality of abortion as well. And in some populations that doesn't get challenged. So, this is a scary time. And I think, I think our job as researchers and advocates is going to be to really gather these stories and the data, but in an understandable way, and really make sure that we are communicating with everybody about how this is going to impact everybody in our country.
Thank you. John.
To that point, I hope that a lot of the audience are students out there in the university, is that you can find your way to help in these initiatives. As a person who's not a person who's, has the capability of becoming pregnant, find your way in what you can do in advocacy. And you don't have to know the fanciest statistical models out there, but there are a lot of places to help in terms of what Parveen was saying. How do we document this? How do we communicate it? How do we translate it? How do we work within the communities that we're in for progress?
Thanks. Awesome. Manuel, anything?
Nadia talked earlier about how some of us see ourselves in individual perspective, others see ourselves as connected. I think that the challenge is expanding the circles of connection, because sometimes you see yourself, your family, maybe your neighborhood, your tribe as being the group that deserves protection and voice. And the thing is, how do we reverse the othering that goes on and expand, as my friend John Powell would say, the circles of belonging, so that the issues of reproductive justice matter, even if we ourselves, John and I, for example, are not likely to have children. The issues of bear children, I'm sorry, because I have 2 children, I better not say that. So that the issues of queer rights matter, even if you're straight, so that the issues of racial justice matter, even if you yourself are not a person of color. How do we expand those circles of belonging? That's really the antidote to this kind of thinking.
Fantastic. Thank you, Daria. Last closing words.
Well, I'm racing against the clock, so I'll make it short. I was part of the march on Washington in January of 2017. The emotion, to use Parveen's reference, there was tremendous. The energy around women's issues. I find myself wondering why there was no similar national response to Dobbs. I have my suspicions, but I think for us to really move the ball forward, we have to address this not just with science, but with that sense of collective belonging to each other that Manuel was just talking about, and with the emotion that I saw on that crisp January day.
Thank you for that. I mean, I'm totally, but I was there too. Thank you for that. And thank you all, actually. I mean, for me, actually, I learned a ton, but I also super enjoyed the conversation. I mean, I think this is exactly the sorts of conversations we need to be having, particularly in this moment. And, you know, as IIGH, I just have to say, institutionally, we're really connected and committed to being a space for these kinds of conversations. And I want to thank you all as panelists for being engaged in this conversation. And I want to thank the audience. And I'm just really glad that we had this conversation. This is our next event, and thank you, everybody. And please, let's just keep working. Okay. Take care.
Thank you, Sophia, for organizing this. This was fantastic.
Thank you.